So I'm just going to start by just gently rolling my shoulders for a moment and just gently breathing into my belly. So just breathing again into your belly and just relaxing the nervous system down. Again, we'll kind of ride that roller coaster of ramping it up with some fiery work where we're going to feel our muscles. This session will be a very hippie session. Not hippie in the hippie manner of things, but hippie in the terms of we're going to be working our hips, that hip love. Some people may have sensitivities to this. We're kind of, the whole premise of this thing is we are creating stress and strain, exposing the body and the joints to different forces, which are stressful in a way. So it's like running that balance of, if you don't stress it at all, again, it doesn't adapt, or it adapts in a way where it kind of just gets tighter and weaker. So if we're stressing the body, we just need to get that balance right. So some of these movements may be new to you, or certainly doing them in such an intensive little, kind of 60-minute setting. So if you're kind of finding something's a bit too full on, just ease off, just go easy. What we want to be doing is kind of, again, exposing the joints and the muscles to a little bit of force without irritating them too much and stirring them up and inflaming them. But again, a little bit of stress and strain and a little bit of inflammation is what allows the body to adapt. And so we're actually trying to utilize that. Imagine someone who goes to the gym, you work those muscles, you break those fibers down. You've had a good workout when it kind of hurts for a day or two or three, and then that's a normal reaction to that workout, and the muscles will repair and they will rebuild and you come back stronger. So essentially that's what we're doing here, and we're doing that and focusing on the deeper tissues around the tendons and the ligaments of the joints. So it's a similar thing. Just understand, it is listening to your body and understanding good pain, not so good pain. So that's part of the art and the science in all of this. And the more you do, the more you kind of start to understand. But yeah, just listen to your body, go easy with some of the stuff. And if you're finding you just need to bow out and have a little break for a moment, then absolutely do that, okay? And then if anything pops up as a bit of an issue and you just could get nowhere near a position, definitely get in touch and let me know, and we can chat about that. I'm enjoying doing like one-on-one onlines in this kind of format as well, and I'm finding that's pretty effective in figuring out how to help people with various issues. We're going to do our morning cars again, our morning routine, which we kind of went through on Monday night. Repetition is a good thing. So we're going to start with our neck, and knowing that with our cars, which is an abbreviation for capsular articular rotation, again working the capsule through its full range of articular movement. When we focus on a particular joint, we're trying to limit movement at the other joint, so then we irradiate a little bit. And what I want you to think about is, let's say we're moving the neck. I want you to imagine that the air around the neck is like 60% denser than what it actually is. So I want you to put that extra bit of focus, like you're moving it through this dense kind of air, and then with that irradiation, in terms of tensing up the rest of your body, like your bum and your core, and making a fist and pushing into your hand, I want you to squeeze that like 10 or 15% harder than that 60%. So 75-80% squeezing your body, and then take your chin to your chest and imagine that the air around is 60% denser, so you have to really fight for this range of movement. So we're coming down. Now we're going to look over to your left shoulder, ear to shoulder, moving nice and slowly, but right to the edge of your available range. coming around the back, all the way around to the other side, ear to shoulder, look down towards that side, scrape that chin down the collarbone, chin to your chest, and then reverse that, scrape that chin across the collarbone, ear to shoulder, come back and around, all the way around, ear to shoulder, looking down, coming back down, and then looking up again. And at the end of each kind of car rotation, I just kind of gently shake the neck out a little bit. With my neck, one thing I sometimes like to do is basically imagine I'm Mr. Squiggle, for lack of a better thing, with a pencil on my nose and I'm drawing an infinity sign. There's something really nice about that gentle movement through the neck. Again, because we hold so much tension, and the other day I was talking about the fight or flight stuff and spending a lot of time in stress response and the effect that has on these muscles, particularly what we call these global muscles, sternocleidomastoid, upper traps. They get really tight. They're the superficial ones, and when they get overly tight, then the deeper muscles, the small little ones that have the finer control on the spine and the various joints in the neck, they don't get to work as well. So a lot of people get neck pain and upper back pain because they're getting this overactivity of upper traps, sternocleidomastoid, and then this reciprocal inhibition and this underactivity of those deeper muscles, the ones that actually control the finer control of the neck joint. So doing little movements is a nice thing rather than just these big global movements there. So in between, when we're kind of just relaxing in between stretches while you're listening to me talk crap, gentle little movements is nice to kind of calm down these bigger ones and then just get those finer movements working well. Hey Johnny, how are you, mate? All right, so we're moving to our spinal cars now. So popping your hands across your chest and pressing in quite firmly, squeeze your butt. Again, with this one, we want to be avoiding too much extra movement or compensatory movement at the hips and the lower body. We want to keep all this locked on hard while we move our spine. And again, imagining that the air around our trunk is like 60% more dense than what it is, and we're going to squeeze the rest of our muscles to 75-80%. So squeezing nice and hard. I want you to take your chest, your sternum towards your pelvis, not like more than what you have to. So it's just enough to start to get the bend to that mid to lower back. And then I want you to rotate to the left and then squeeze that shoulder down towards the hip. And then we're going to come back around to the other side, shoulder to hip, rotating down back towards the front, trying to minimize too much hip movement, shoulder to hip, come back around. Imagine our hip bones are high beams and they're continuing to face forward. We're not rotating them around too much. So we're really focusing that movement to the spine. That itself is a beautiful movement, that one there, and you might feel things kind of clicking and moving up the spine a little bit. That's perhaps because that part of your spine doesn't move regularly enough or in that way. So we're really taking those joints to their end ranges of movement, and I use that analogy of the cookie bowl with chunks of cookie dough left in it that might be kind of sticky bits in the joint articulation because it doesn't often get moved in that way. So by doing that with that kind of focus and intent and muscle activity, I really like to imagine that we're kind of creating that stimulus to clean that joint right up and just get it articulating really smoothly and getting all the muscles around that working nice and smoothly as well. So we're going to go to our shoulder now. So again, let's go for your right arm. I have trouble knowing if it's your right or left. Is the phone my mirror or is it? I'm not sure. So I'm using my right arm. Facing forward for me, squeezing your hand into your body, squeezing your butt and your core. Now come forward for me. We're going to come slightly across the midline and then right up to the sky to the point where you hit a brick wall, and then we're going to turn your thumb in and then keep turning to the point where it turns out, and then take it back, all the way back. Keep turning that arm as you have the range, and just get the back of your hand to the outside of your thigh, and then come back again, over, all the way round, palm comes to face forward, and then back to the outside of your thigh again. So then let's swap sides, up tall, and again, we're not doing this right now. The shoulder is the hero joint. That gets all the attention. The air around the arm is 60% denser than what it actually is. Let's imagine that, and let's tense our body up to like 75, 80%, because that irradiation allows us to get even more focus and more activity through that shoulder joint. So now facing forward, tensing everything up. Forward we come, slightly across the midline, coming all the way up until we hit a bit of a brick wall, turning that thumb in, screwing it all the way out, take it back into extension, keep turning as we come back. The outside of your hand touches the outside of your thigh, and then we go back again, shoulder extension, starting to rotate that thumb towards the sky, keep coming all the way around, and then back to the front again. Very nice. Our shoulder blade cars, or your scapular cars, I'm going to show you a different way to do it this time, because it's nice to have options. So last time we had your middle finger down the seam of your pants, or like your pocket, and we'll move it from there. This time I want you to bring your arms forward. Now again, where the shoulder blade is the focus this time. So we want to avoid bending the elbows, anything else, but our arms are forward like this, and I want you to push your shoulder blades forward like you're opening up the back as far forward as you can. Then we're going to lift the shoulder blades up as high as you can. Then we're going to come back to that back, up and back corner, then down and back, down and forward, up and forward, up and back, down and back. Then we're going to go back and up, forward and up, down and forward, down and back. Keep going, up, forward, down, back, and relax. Shake everything out. Don't know why I like that cookie bowl analogy, but I kind of even do a similar things with my shoulders, and almost just imagine that I'm using the outside of my hands to like clean that big bowl. You would have seen Ido Portal and Conor McGregor doing their walk with their hands, like it's their kind of monkey walk, but it's their way of allowing the arms to be nice and loose. So if we have those small little figure of eights movements in the neck, and we can allow our arms to go nice and floppy and our shoulder blades to move around like that, it's a great way of kind of getting rid of that tension, particularly if we're, breathing into our belly and being very nice and relaxed. So it's a good thing to do regularly. Now, going to skip the hips, come back to the hips, because this time I am going to challenge your balance. So if you are in standing, that's great. Let's come to our feet and just switch them on. So if you can see my feet, great. If not, you can listen. Now we're going to go big toes up, big toes down, big toes up, big toes down. Also try and think about the big toes going in, so they're not what we call abducting away, which would, if you can imagine that kind of bunion setup, when that bone on the inside starting to protrude and our toes getting pushed that way, perhaps because it's been pushed that way in tight pointed shoes for a lifetime. So the way to kind of either prevent that from happening or help manage that is activity through the foot, and also trying to imagine that it is not getting abducted that way. So we're going big toe up, big toe down. Now if you have no connection between your brain and your foot, then go 1 foot at a time and just give it a bit of a hand. You might even push the other side down. Don't mind me. Thank you, Larry. I appreciate that. Big toe up, big toe down, big toe up. If you need to help it up, you might just then hold it and then control it down. You might need to give it a hand up, control it down, helping the other toes stay down. Or if you're getting good at it, you can just do it without it. Happy days. I used to not be able to independently move my toes, and now they do it quite well. So just practice makes perfect. And then we're going to go to the other toes. Big toe pressing down, other toes coming up, and try and even spread those toes. Toes down, toes up and spread, down, up and spread, pushing that big toe into the ground. Now what you find, and what I have found, spending lots of time over the years trying to get people to activate through their glutes and sort out their mechanics, perhaps before I was giving the feet enough credit for their role, and these people having pretty sleepy feet and not utilizing the muscle in their feet. We have 4 layers of muscle in our feet, and they have the ability to do lots of amazing things and lots of control and create a lot of power and absorb a lot of force, which would otherwise go to other joints. So if your shock absorbing capabilities of your feet is working well, plus the control is really good, that's a good thing. But then also having that foot nice and active, it's that link in the chain, and then we can ask our butt to work properly. It would be a difficult thing asking your glute to work really well if your foot is not really active and our feet are not creating that nice strong foundation from which to allow the other things to work really well. So waking up those feet is definitely something worth spending time on if yours aren't working that well, and then even if they are, then they can be working better. So now our feet are active, we're going to do our hip cars. So get that foot planted into the ground. Imagine a tripod, base of the big toe, little toe, and the heel anchoring in. That's your foundation, and you will always be able to kind of draw upon that. From there, don't let this knee drop in. We're going to straighten that leg, and we're going to do our hip car here. So drive the opposite knee up as high as you can. We're going to move into external rotation, which is that hacky sack kick movement. Take it out into that outside corner. Your balance may be challenged, that's fine. We're then going to move into internal rotation of the femur. The foot comes out, but that is internal rotation of the femur. Getting up over that hurdle as high as you can. Keep coming around, squeezing that glute. Keep internally rotating till your knee touches the other knee. Then extend up over that hurdle. Keep coming back around, external rotation, and back down again. Now again, everyone's structures are shaped differently, obviously based on that individual person, as well as based on the way they've lived their life to that point and how their body has adapted. So your hip joint cars, your capsular articular rotation of your hip joint might be like this. And I mentioned that the other night, and if that's where yours is, that's absolutely fine. And that's where the edge of your joint that you are now applying that stimulus to adapt, that's where it is for you. And don't try and force it past that. Just work the edge of that joint and really focus on that. You don't have to, push beyond that point. That would, be kind of creating irritation more than what you want. But a little bit of gentle stress and strain at the edge of your available range is what we're trying to achieve. And then we swap sides, anchor that opposite foot down, get that tripod, spread those toes if you can, lift that knee up nice and high, externally rotate, come out to that corner, internally rotate. My cars on this side aren't as good, and that's fine. Keep coming around, back around again, over that hurdle, external rotation, and back down again. So why do I have slightly different cars on both sides? Well, I was a left footer in football. I spent all my time kicking up like this. So it would make sense that the hip joint on my left side is much more impressive than the hip joint on the other side. So it kind of, again, takes away that question around why are they different? Why aren't they symmetrical? Yes, we would love everything to be symmetrical, but it's very, very unlikely that would be the case. So one side will be stronger and more controlled and have better ranges of movement, because like we mentioned the other day, one aspect of mobility is coordination and neuromuscular control. So having better coordination, strength, and neuromuscular control allows the nervous system to trust the activity around that joint, and then it would perhaps give you a greater range of movement because it knows that it can control that, right? So we're going to move into a middle split. So again, where that is for you will be different for everyone. Now, how do we do this safe? We create tension at the extremes of range. So I had someone ask me about elbow pain when they do handstands and things like that. If you're taking a joint to its end of range and you have no muscular control at that point, then you are taking the joint right to the end of its range. Here I'm just bending my finger back right to the end of its range. If I was to hang out there for a little while, that would start to get irritating because I'm stretching the ligaments and I'm irritating the joint. Now, if you did the same thing to an elbow, if you did not have the control and the activity and the awareness of loading in that position, end range control, then you would be creating excessive stress and force on the joint itself, which would be, irritating it, creating wear and tear. So a big thing of what we're trying to achieve is control throughout range and end range control. That's the ultimate goal. Because what we find with a joint, if you were to get a graph of the force that you can produce in a muscle, what we find, imagine you were doing a bicep curl and you were to graph the kind of amplitude of force, what we see is in that middle range, we're super strong. Like if you were going to hold a weight there, that'd be great. You'd feel super bloody strong there. What we find is at the end of ranges, it isn't as strong, and out here it isn't as strong. You might know it's hard to get it going. If someone just gives you a little fingertip to help, boom, we're up, and then you can take it from there. Now, what we want to do by improving our mobility is spread that curve out. It's not like flattening the curve we're trying to at the moment. We're actually trying to lift those other parts of the curve and flatten that out so we have more muscle activity in the inner range and more muscle activity in the outer range, and then we're going to be able to control that joint and prevent too much stress and strain at that joint, particularly at the end of ranges. So right now, yes, we are taking our knees to the end of range, but what I want you to do there is squeeze your quads. So we're not just hanging out, we're actually activating there. And then I want you to think about wrapping your femurs out and tucking that pelvis under a little bit. So you're going to squeeze your butt. And then I want you to think about driving your feet in towards the ground, in towards each other, creating an adduction force, which would activate your adductors there. So then what happens, our nervous system goes, okay, we've got muscle activity. We're taking these joints to the end of their range. We're getting a groin stretch, but all of a sudden, if we squeeze our butt, squeeze our quads, kind of irradiate a little bit, squeeze your fists, really drive in, because we know that irradiation force, we get carryover of muscle activity through the joints, through the muscles, to each next consecutive muscle, like a flow-on effect, driving in. I then want you to go the other way, like you're pulling your feet apart. Now, I don't want you to actually allow your feet to slide, but that's the activity that your butt is doing right now. It's pulling apart. Now, you might find that you're not getting a good activation or like a good purchase of your glutes there. That's because perhaps you haven't done this before. You might need to just bring the feet in a little bit, take away the challenge of touch, and get them firing up there. But it's very good for improving the strength and the control around these hips, which a lot of people find they get lateral hip pain. This can be really helpful. And then we relax a little bit, kind of just hang out, but keep the control. Keep the quads on so they're protecting the knees. Keep a little bit of adduction force so you're protecting your hip joints. And we're just relaxing in between. And then go again, drive the feet in to the ground, creating an adduction force, and build that up, ramp that up. What we know is creating that activation and getting that strength through there, the nervous system starts to trust this range. We also have this thing called autogenic inhibition, which is when you've activated a muscle, we know that then the nervous system afterwards allows it to relax a little bit. So we activate these muscles and we really crank it up and irradiate and build that up to like 80%. And then we go the opposite way. We pull apart crank up our glutes, pulling our feet apart, and then we can relax again. And you might even trust the range a bit and allow your feet to gently wiggle out a touch. The other thing about improving a range of movement is kind of feeling some slightly different angles. So we've been in one angle this whole time, but what happens if you just hinge forward just a little bit? It's called a good morning to just hinge at the hips, and then we're coming up. So you don't have to go all the way into that good morning, but keeping the chest proud, gentle little hinge, and then come up. And again, the nervous system starts to go, okay, we're kind of like exploring slightly different angles. We're keeping a little bit of adduction force. It feels quite nice. And we're not creating too much irritation. We're not just hanging out at the end range and hoping for dear life that we don't tear something. We're very active and very controlled in this. But we've spent a lot of time in that position, so let's ease our way out of it. I'm going to take my hands down nice and slowly, take my knees down, and come around like so. Oh, good work. So, I was kind of starting to cramp up through my quads. I held on to that. In a lot of these movements and these exercises, the muscles will cramp because they might be new to you and you're working right to the edge of what the muscle can handle. What I like to kind of advise is try and just stay on like the better edge of that. You know, we don't want to, it's all about time under tension with this stuff. So that's why I held it there for so long and chatted our way through it. The longer you're there, the better, because we know that it takes like a good 2 minutes to actually get an actual change in the muscle tendon length tension relationship. So if you do cramp, sometimes that throws you out of position and then we lose our time under tension. So we want to stay right to the better edge of that, so you don't lose it because of the cramp. Hey Dan. All right, thank you, I appreciate that. My left foot is my left. That's good to know. Okay, so just some gentle cat-cow, head up, bum up, head down, bum down. After doing a little bit of fiery stuff, it's then nice to wind it down again. The fiery stuff is the fight or flight stuff, activating the sympathetic branch of the nervous system, which is the stress anxiety response, preparing the body for threat, which is all well and good and very effective, but again, we spend too much of our time in that zone anyway, involuntarily and perhaps not realizing it. So then to wind everything down, to breathe into our bellies, to relax everything and allow the body to go a bit jelly, we start to activate the parasympathetic part of the nervous system. And that's literally like getting the volume switch on your nervous system and just dimming it down and winding everything down, which is very good for our body, because too much time spent in that stress response, we know that that can create inflammation and tension and increase your sensitivity to pain, reduce your pain threshold. And if we were going to reduce your pain threshold and increase your pain sensitivity and increase inflammation in the body and increase tension, well, that would be a pretty sensitive, pretty painful environment for the body. So coming into this parasympathetic part of the nervous system more often is a great idea, and everyone should be doing it. So cat-cow is always a good thing. All right, bring your left foot up, now that I know that that's your left foot. Tuck your pelvis under and just drive that hip forward, your right side, squeezing that glute. Again, not doing anything overly impressive here. We're just tucking that under, squeezing that glute. And then I'd like to get you to take that arm over, and now take the other hand over that elbow and even just give it a bit more of a stretch. You pull your trunk and your shoulders and your body back and away from that right hip, and squeezing that glute, tucking the pelvis under, gently pushing those hips forward. And now create an activity like you're going to side flex down, but you're keeping it on stretch, and you're using the resistance of this hand pulling you that way and meeting that resistance while you squeeze that glute. And what that does is activate all of this stuff from the tricep, the lat, down the side of your body, the hip flexor, down the glute. This is all connected. It's all connected through these fascial lines and myofascial trains and all this, which you may have read about and heard about. So we want to get all that moving, and the best way to get that deep tissue moving is by strong activations. We have to kind of like smash through that. If we're just going to hang out in a hip flexor stretch and hang out for a long period of time, that's all well and good, but we need to get some serious activity to actually create significant change in the length of this tissue. So we do that by utilizing our little, our tools that can function on the nervous system, like strong activation of the muscle. So we're pulling that elbow into the hand, creating a strong activation, and we're ramping that up to like 70 to 80%, squeezing that glute while you're continuing to pull yourself deeper into that stretch, and then reverse the contraction. Actually actively pull your body away, squeeze that glute, get that stretch, open that shoulder, that lat, that hip flexor, keep going, then create another resistance pulling your elbow and your body that way. Meet the resistance with the other hand, keep squeezing that glute, keep tucking that pelvis under, deep breathing into your belly, then pull yourself further into that stretch, keep going, and then just relax and melt a little bit, because those tissues can now, we know they'll be more relaxed after having that pretty deep activation. Keep squeezing that glute and tucking the pelvis under though. And back into that belly breathing and relaxing. And come back up again. Very nice. Hands coming down. And just pushing through those hands. And again, thinking about that elbow analogy, we don't want to necessarily be loading at that point. So always just thinking about that little bit of activity. Soften the joint a little bit, meaning we just come just out of end range, activate the muscle there, push through the knuckles of your hands so your knuckles aren't lifting up. I'll never forget that cue from Stu. He was always big on that in yoga. In downward dog, you see people's knuckles raising up like this, and they're just putting all that force jamming straight through the wrist. So if you're getting wrist pain with anything, make sure that you're pushing those knuckles into the ground. If you're doing handstands or whatever, downward dogs and yoga and everything. So, and here we're just going to take that knee out and back in again. Out, and we're doing this actively by using the glute, pulling that knee out and back down, out and back down, out and back down, really squeezing through that glute. Do one and just hold it for about 10 seconds. Matty Gwad, welcome. Jess Rep. Sally, how you doing? All right. Let's see, comparing to the other night, let's see if morning is any different to evening. So I want to see, can you get your elbow to the ground? You might need to gently take that knee out, touch, and then we're going to rotate up. Just going to do 5 of these. Touch and come up. Now if you can't get there, if you get to there, that's absolutely fine. It's a bit of a reference point, maybe like get that reference point, just get a shaka of going, okay, that's about where I'm at, or maybe you're a fist away, but it's nice to have a bit of a reference point on going, where am I at? Because if you do this regularly enough, we'll get some changes. Good. All right, back up again into where we were for our hip flexor stretch. Now, I want you to, you don't have to necessarily straighten this front leg, but we're going for our diagonal stretch. And the key, what I want to achieve, is keeping the pelvis tucked under, maintaining integrity of this back and not just cranking into an arch. This is all very controlled. And what I want you to do, take your right hand over your left shoulder, and we're just going to reach back, touch that left heel. Come on up, reach back, touch that left heel. Now as you start to get a little bit more advanced with it, it's nice to go for a straight leg on that left side, because what you can do with that mobility and activating through the quad and pulling that heel in towards the ground, that can actually help you control this. Squeeze your right butt cheek and rotate around and touch. And then as you start to feel better with that, you can really tuck under at the pelvis arch and rotate around, and then you can enjoy that stretch a little bit more because you've got more activity helping you with the balance, so you're not just kind of trying to balance there. Tuck, turn, and we're going to hold this last one for 10 seconds. Squeeze that glute, rotating, lift through that chest, touch that heel, squeeze that left quad, hold that there, keep going, and come out of it. Very nice. Over to the other side. So we need to do our hip flexor on the other side. Up we come. Tucking that pelvis under, taking that arm over. Hopefully I'm not in as sweaty pit territory as I was on Monday night. Looking back on that, that was getting pretty crazy. So I do apologise. And I need to pick the right shirts. Squeeze that glute, tuck the pelvis under, pushing forward. Take your elbow up and over. Use the other hand to pull yourself into a deeper stretch. Again, thinking about the connections of all that fascia all the way down this side, all the way down, even that ITB all the way down. And then we're going to use this hand to pull yourself into a deeper stretch. Keep squeezing that glute, tucking the pelvis under, driving that hip forward. Now start to build the fire in the stretch a little bit, like you're going to side bend down towards the ground. We're not going to move that way, but that's the activity we're doing, and we're using the other hand, to stop you from pulling that way. Squeeze the glute, pull yourself into a deeper stretch, meet that resistance, build it up to like 60 to 70%. Now keep going. I'm just reading a message here. Sweet, keep going. Keep building that up. No worries, Dan, I'm glad you enjoyed the spinal stuff. Keep going, keep squeezing. Now let's go the other way, so actually drive yourself into more range. So you're using the muscles on the other side to actually open it up even more. Keep squeezing that glute, keep opening it up. And then just relax there, but stay on tension. Time under tension is key. Keep squeezing that glute though, maintaining integrity through this area so that we're not just arching the back, we're keeping that pelvis tucked under, posterior pelvic tilt there. Keep squeezing, keep opening. Let's meet that resistance again. So the hand pulls into the elbow pulls into the hand, and we push our trunk away from our hip with the knee that's on the ground there. Build that intensity up to 70, 80%, and then reverse that contraction and open it up even more. World's greatest hip flexor stretch without using other equipment. And then just relax from there. Very good. Coming back forward. Hands down. Rotating that knee out, back in, out, and back in. Activating through the glute, opening up through that hip. Again, an active mobility exercise. We're not just passively pushing on that joint, we're actually using the activity of the muscle. Bobby Birdsall from Canada, how are you, mate? Good to see you. All right, keep going. Then we're going to hold one for 10 seconds, squeeze that glute, even squeeze the other glute, because that allows you to then squeeze that glute even better. Open up that hip joint. Good work. Rotating, or let's touch that elbow down and see where this side's at. Can we get it to the ground? Or are we a fist or a shucker away from that ground? Check it out. And coming up towards the sky. Elbow down. Opening up to the sky. Elbow down. Opening up towards the sky. As you can see, we're kind of moving between, and we're just going to hold this one we're moving between those sustained holds with those ramping up of muscle activity, which really helps to expand the ranges of movement. And then we move through dynamic movements, which allow us to kind of articulate those joints in perhaps their newer found ranges of movement there, while we have the trust of the nervous system because they've felt those deep activations of those muscles there. So, coming into this position, are you just in this 90-90 here and here and coming back there? That's absolutely fine. Or do you want to challenge yourself a little bit more? Straighten that front leg, activate the quad, and drive that front leg into the ground, open up through the chest, reach for that heel and come back, reach for that heel, come back. Again, your left hand is holding onto your right shoulder, helping you to get more thoracic rotation, coming around and touching. Keep going for us. Around, touch, and back. Around, touch, around, touch. And last one, we're just going to hold it, tuck under, squeeze that left glute, lift through the chest so that you're not just cranking in your lower part of your spine. Hold that there, drive your right heel into the ground, squeeze your right glute as well, open up through that chest, keep rotating, and then come out of it. Very good, and come back down. Now, you may not have been able to touch your heel, it may not have looked the same, and that's absolutely fine, because that's where you're at right now, and that's all good. Again, I'm a tight human being, and I was even tighter before, and I'm slowly getting there, and I'm enjoying the journey. Again, you're either moving forward in this game or you're not. So you're either getting more mobile, and just pop into this 90-90 position again for us. You're either applying stimulus into the body that's going to help it to adapt to get more mobile and stronger and more resilient, or we're essentially applying a stimulus to the body by not doing anything, which would allow it to get weaker, tighter, stiffer, more deconditioned, less resilient. So obviously in this life, we want to be doing the things that are going to allow us to feel better, move better, and be a little bit more resilient in our body. The kind of idea of bulletproofing your body, and I guess it's a popular idea. We want to create that resilience, and that's what we're trying to do. Is really by improving our mobility, our control throughout range, and our end range activation and control. Well, that's going to improve the health of the joint, because it's got this really strong muscular network around that joint, and that's what we're trying to achieve here. So in our 90-90 again. Now what I want you to do here is just gently rotate the pelvis forward and back and kind of explore that joint a little bit. So it's a little bit like the cat-cow we were doing, with the idea here is that we're just seeing what range we have kind of available to us. And again, with mobility, if we only ever explored one path of tension, you will never achieve really good mobility and really good health of a joint, because then there might be other little paths that haven't been kind of explored, and there might be this really tense band that we haven't actually explored. So it's just nice to kind of, the terminology might be grease the groove, just kind of feel into that joint, again like that cookie bowl, and we're just gently scraping the edges and feeling what that feels like. Now we're going to lean or lift our chest up, hinge forward at the hips, get a nice deep glute stretch on that front leg. Shoulders are square to that leg as best as you can. Again, you might be out this way, which would put me out of the screen, and that's all right, just understand that what we're trying to achieve with this one on the front leg is a deep glute stretch, and we do that not by coming down here and rounding the back, but by keeping the chest proud and hinging forward at the hip to that square leg there. So hopefully you're feeling a nice deep glute stretch, and then we're just going to create a bit of tension, drive that leg into the ground. Keep going there for us. Build that tension up, Build the intensity up to 70 to 80%. Squeeze that glute. So you're stopping yourself from falling forward by squeezing that glute. If you wanted to take your hands away, you could do that because that's the activation you're getting. Then we're going to reverse the contraction and actually use the muscles on this side to pull yourself a bit deeper. And then just relaxing in perhaps a slightly newer found range of movement and just enjoying that deep glute stretch. Keep yourself open through that chest, leaning forward. Now I just want you to gently come over to your right if you're on that side and just explore that range through here in a nice little spinal twist. Even lift that left shoulder up and kind of come back and through, maybe do a couple of those. Come up, open up to the sky, come back and through, up, back, through. We're going to come back through now to the other side. So we're going to sit up tall, lean back and get an internal rotation stretch on the left side. I'm not going to work you through too much on this side. I just want to apply a gentle stimulus and go, okay, yep, there's my hip internal rotation on that side by lifting up tall and coming back. If we were going to work through the full 90-90 routine, I might spend a lot more time and do those alternating isometrics where I would drive that leg into the ground and then reverse the contraction. But we're just going to get that little bit of internal rotation exposure there. Maintain a little bit of activity by driving the foot into the ground, so we're not just hinging on it. I just want you to just activate it a little bit to control that joint. Come up tall, grab onto your feet and then twist your spine the other way. This will apply a rotation through the spine slightly higher than where we were before. In that kind of thoracolumbar junction, which is nice to get that part of the spine moving. Over to the other side. Up tall, chest up, gently leaning forward, aiming for a deep glute stretch. How does that happen for you? It might be slightly different for everyone, but try and square yourself up to that shin. Try and lean forward at the body. Leaning forward at the hip, keeping that space, hinging forward at the hip. Let's start to ramp up a bit of a contraction. So you're activating through that glute, driving your whole leg into the ground, stopping yourself from falling forward. Build the intensity of that contraction up to 70, 80%. Really drive into the ground. Can you create any more muscular contraction by irradiating, by squeezing your other muscles, by even driving the other foot into the ground? Keep going there for us. No worries, Nina, my pleasure. Activate the muscles on the other side of the joint like you're trying to pull yourself a bit deeper, pulling yourself into that deeper range. It's an awkward one, this one, because we never do it, but by activating muscles on both sides of the joint, we're going to be helping to protect that joint, as well as move into a new range of length through the glute. And then we're just going to relax and back into that more belly breathing and that parasympathetic nervous system. It's just past 8:30 and people might need to be starting to think about work and stuff, and that's absolutely fine. So if you've got to do that, please feel free. And I hope you've enjoyed the session so far, and we're just going to slowly get towards finishing up. So if you don't have to go anywhere, hang in there with us. Up tall, we're just going to lean back into an internal stretch on that right side. Up tall there. Gently get a bit of activity through that hip, driving that foot into the ground, but essentially the sensation on this side should be a deep stretch through that hip. That's the deep tissue of the hip joint that it doesn't often get addressed. So we're just gently addressing that. come back up, come back to that front leg and just walk yourself around, get a nice spinal twist. Explore that a little bit. Twist, come up towards the sky, come back down. Just do a few reps of that. Up towards the sky, come back down. Sky, come back down. To the other side, up tall, grab onto those feet. Up tall, twist and rotate. Push your hands into your feet. Push your feet into your hands. Allow that to twist you further. Now, I'm just changing my angle so you can see. Just going to work some very gentle 90-90 transitions. Again, we've worked the range. Can we now move through some different angles and activities? So we're going to, this right leg, if that's the side for you, we're going to lead with that leg and move into the other 90-90 position, just like so. Now the idea here is the front leg leads, that opens up, gets as wide as it can, and then the other leg follows, and then we sit up tall there. And we transition, and we transition. And we transition. Back and forward like that. And it's really, again, greasing that groove of the joint, scraping the edges of that joint while we're improving the neuromuscular control and the awareness around those joints here. And it's just a nice thing to be doing. Pop back onto your front. Take your knees nice and wide and line up your feet with your knees and your feet are pointing out. This is called frog pose. Get nice and wide there. Now I want you to take your hips back, sit them back into that hip joint. Play around again, a little bit of cat-cow in that position. Exploring the different angles and different parts of that joint. Now again, we don't just necessarily want to hinge at the end of that range because that might create some irritation. So we're going to then drive our knees into the ground like we're trying to squeeze them in towards each other, but obviously the ground won't let us do that. So crank that in. You'll actually squeeze your glutes while you're doing that. Take yourself right to the back part of your hip joints. Lift your chest a little bit, squeeze your knees into the ground, get that activity through the adductors. Build that up to like 80-90%. Then reverse the contraction, like you're going to pull your knees apart. It won't happen, and I'm yet to create injury in anyone by doing this. The body will only actively take you to a point, so try and pull those knees apart, squeezing those glutes. Relax, breathe into your belly, enjoying those relaxed moments in between the more fiery ones. Explore that range again, a little bit of cat-cow there. So what you see, we're improving hip mobility, or we're working our hips, and we're hitting it from every angle possible. And there's more angles. This is a lot of them, this is some of them. But this is what's going to help to improve those ranges of hip movement. Plus this kind of exposure will create, I guess, a stimulus for the hip joints to adapt, which over time you get more and more mobile, and the actual health of the hip joints will improve. Let's go for one more rep where we're pulling our knees in towards the ground, building up that glute activation. Crank that up to like 85-90%. Go the other way, pulling the knees apart. Up nice and tall. Keep pulling them apart. Can you get any wider? And then just relax. Very good. come and pop into just sitting comfortably, or however is comfortable for you, and relax the shoulders, do some little figure of eights with the neck, sitting up nice and tall, maybe a few little pelvic tilts here, like a little cat-cow. I've got a bit of grass and have been bitten by a couple ants, and that's all right. Now I just really want you to do some belly breathing here just for a minute or so. You've done some good work, some different work. Again, creating that little bit of stress and strain, which the body will adapt, and the art is in getting the right balance there. Not doing too much, but at the same time, if we don't do anything, it just gets stiffer and tighter and weaker. So we're actually greasing it up, getting it moving, getting it all stronger, and improving the coordination around these structures, which will improve our mobility, which is our control through range, and help to improve that end range control, which is our protection against injury and our protection against joint wear and tear. So what we're doing now, the stimuluses that we apply to our bodies now, help to set it up for down the track and make sure that we have nice mobile spines and good strong joints heading down the track. So that's what it's all about. Again, just breathing into your belly, relaxing those shoulders. Over the week, just keep checking in with that kind of the mechanics of your breathing. Again, that stress anxiety response type of breathing is short, sharp breathing into your upper chest, where you're getting extra unnecessary activity in those upper traps and the sternocleidomastoid and the scalenes and the things that pull the chest up and out. Whereas nice relaxed breathing, we're just breathing into our belly, turning down that nervous system, just breathing as we're meant to be breathing in normal day-to-day life, not when we're kind of unknowingly caught up in that stress response. So I like to think like at the traffic lights is always a good place to check. You know, you just got that red light, you might be running late somewhere. Are you kicking into that stress response pattern of breathing, which as far as your body's concerned is like a threat? Your body's under threat all of a sudden because you might be running a couple of minutes late. So just check it, come back to that belly breathing, relax that neck, relax those shoulders, and you immediately start to switch down into that parasympathetic part of the nervous system and start to feel a whole lot better. So I've talked a lot about that, but it's damn important, and it can change the way you go about your day-to-day life, so it's definitely good to know about. Thank you very much for joining me again, guys. I'm not sure how I'm going to structure it going forward. I might do it via Zoom and actually set it up as proper sessions where people check in and we do it that way. But yeah, watch this space. Nikita is doing a live free Pilates session tomorrow, Thursday tomorrow, at 6 p.m. So that'll be in the studio there. It'll be a mat Pilates session, so please feel free to tune in. Less of the tough mobility work, more of the glute activation work, and the two things just complement each other so well, because we know that by improving the activation of our muscles, that's going to help our nervous system trust those joints, and then we're going to get less wear and tear on the actual joints themselves. So doing that Pilates session will certainly complement what we've done so far this week. And let's keep in touch. We'll keep trying to pump out stuff for you and content, and just keep connecting through the interweb. All right, guys, thank you very much. Stay safe, take care, have a good Wednesday.